So in America right now, we're having a conversation about healthcare, about whether or not we should go to a single payer system. Well, look, single payer is obviously the way to go. Medicare for all. You expand Medicare, you cover everybody. No deductibles, no copays. It's actually cheaper on the administrative front. We don't have to pay for executive bonuses or advertising costs or things like that. So single payer healthcare is a fantastic idea. Nonetheless, we seem to be having a debate about the role of the government when it comes to covering people in healthcare. Now, in Canada, they don't have that problem. And in fact, in Canada, one of the biggest protests in their healthcare system that's happening right now is a protest by doctors who feel they're getting paid too much. I kid you not. According to Newsweek, hundreds of Canadian doctors, medical specialists, and residents, as well as medical students, have signed a petition protesting pay raises for themselves. They instead asked that this money be reallocated to help both nurses and patients in need. The letter posted in French because it's, of course, in a certain Canadian province in which French is the main language. They said, "We Quebec doctors who believe in a strong public system oppose the recent salary increases negotiated by our medical federations. These increases are all the more shocking because our nurses, clerks, and other professionals face very difficult working conditions, while our patients live with a lack of access to required services, mainly because of the drastic cuts in recent years and the centralization of power in the Ministry of Health. The only thing that seems to be immune to the cuts is our remuneration." Now, they continue, "We believe that there is a way to redistribute the resources of the Quebec health system to promote the health of the population and meet the needs of patients without pushing workers to the end." Now, okay. Redistribution. I'm pretty sure every conservative had exploded upon hearing that message. But everybody else who's left, look, that makes sense, right? So, look, what's going on is nurses are underpaid. And of course, conservatives in Canada have tried to dismantle the single payer system slowly by making budget cuts. It's what they're also doing in the United Kingdom. Now, publicly, of course, they can't come out and say, "Oh, we would rather have the American healthcare system where all the money comes from goes to private corporations, and those private corporations then will buy us off with campaign donations." It doesn't quite work like that in Canada, from my understanding. But there are conservatives that are in line with private interests that would love to see privatization of their system. They can't come out and say that because every voter, almost every voter, I should say, would be against it because Canadians genuinely love their single-payer healthcare system. Now, doctors. Now, here's the thing that you hear about Canadian doctors. Oh, my God. Canadian doctors, they don't make enough money. In fact, they are fleeing Canada to go to the United States. Well, here's some numbers that might interest you. The average Canadian physician in 2016 earned around $260,000, according to a September 2017 report from the Canadian Institute for Health Information. Now, the Institute clarified that this figure indicates only gross pay and doesn't account for each doctor's overhead. So there is a chance that they could get paid, that they're actually getting paid even more than $260,000. This is in Canada, which conservatives are like, "Oh my God, all the doctors are fleeing Canada because their socialist healthcare system doesn't pay doctors." These seem to get paid quite a bit. Of course, I guess if you compare it to American doctors and, more importantly, American health insurance CEOs, well, then $260,000 is peanuts. But nonetheless, I say it's pretty good. Now, the group that published the petition is, Médecins Québécois pour le Régime. I'm sorry, I cannot speak French. I apologize. But let's just call it the MQRP. Now, they also had authored a February 17th letter opposing $500 million in pay increases for specialist doctors, calling those increases indecent. Now, the latest letter comes after nurses held a sit-in to protest their working conditions. On February 1st, a group of doctors published a letter of solidarity supporting their colleagues. Quote, "The subject of nurses' work overload is at the heart of the news following the sit-ins," the MQRP wrote. MQRP joins its voices to those of nurses to denounce this unacceptable situation, which affects the quality of care for the Quebec population and weakens our public health system. We also wish to remind the government that the current situation is far from normal or inevitable, and is largely caused by the cuts it has imposed on the public network. More than 700 people have added their names to the petition since it was published on February 25th. As of earlier this week, at least 213 general practitioners, 184 specialists, 149 residential medical doctors, and 162 medical students had signed the petition, according to numbers from from CNBC. So, here are doctors in Canada trying to protect their healthcare system from cuts by passing on increases to their own pay. They're like, no, don't raise my pay. Give it to people who actually need it. We get paid enough. Now, contrast that to what's happening in America, where 45,000 people a year, according to a 2009 study, died from lack of health care. But in Canada, who dies from lack of health care? Nobody. Everybody has the ability to go and see a doctor. Yes, there are elective surgeries that have waiting lists. I'm not saying that their system is completely perfect, but it's a hell of a lot better than what we have here. In fact, the Commonwealth Fund has rated the U.S. healthcare system as the worst among the 11 developed nations it analyzed as part of an evaluation conducted every 3 years. They also rated the U.S. healthcare system as the worst performing of the nations analyzed when the last evaluation was released in 2014. This is after Obamacare was passed. Look, conservatives want to say, oh, look at all these countries with socialized medicine. They have terrible service. Oh my God, they perform horribly and they're horribly expensive. Look at all the taxes they pay. But wait a minute, the UK, which is first on this list, by the way, ranks first, is actually, look, we spend twice as much on our healthcare system per capita than they do. And we have the worst performing healthcare system of all the nations and most expensive. And there are thousands of people who die every year for lack of health care. And here in America, we're talking about access. Oh, we should all have access to be able to have health care. No. We should have health care. Health care is a human right. Look, and that same thing, Canada ranks 9th. But I think there's a big difference. There's not a big difference between 9th and 11th, but there's a big difference in our healthcare programs. They have a single payer system. We have for-profit, profit-driven healthcare. Come on, man. And look, the UK, as I said, ranked first on that, followed by Australia, the Netherlands, and New Zealand. Not only that, but the United States ranks 37th in healthcare in the world. I wonder why that is. We've got to open up Medicare. We have got to expand Medicare to everybody. This simple story points out the complete difference in the attitudes about healthcare. Like I said, these doctors in Canada, they're like, we get paid too much. We want to actually protect the system. We actually want to take care of Canadians. Here in America, look, in America, we do have groups that are actually pushing for Medicare for all. The nurses' unions. The nurses come to save the day. National Nurses United. They're the first to line up behind Bernie Sanders and to line up behind his single-payer Medicare for All plan. It is the nurses in both countries that are pushing for social justice, which is amazing. And we should definitely listen to and support our nurses. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.